Well, first of all, thank you all for coming.
Well, no, they set me up here because they said I had to put an ID in. There you go.
So thank you all for coming today. I'm Sharon Tucker. I'm the interim clinical director for Med Surgical Services. And I just want to share a little history about the Daisy Award and how it came to be. Many of you know that in 1999, a patient, Patrick Barnes, was diagnosed with idiopathic thrombocytopenia purpura. Easy to say. And during his hospitalization, he and his family experienced what they described as the best of the best nursing care. The nurses were the ones that dealt with his complex medical situations. They're the ones providing that ongoing loving care. It was the nursing excellence, kindness, and compassion during Patrick's hospitalizations that the family really remembered. The nurses were always present, always caring, and always comforting during his patient's hospitalization. Days later, after Patrick passed on, the family talked about what they could do to recognize the excellent nursing care he received. And his wife came up with the acronym DAISY, which stands for Diseases Attacking the Immune System. This was the beginning of the DAISY Award. It is given for extraordinary nursing care by extraordinary nurses. And the DAISY Award is recognized and used by healthcare facilities all over the country and in other parts of the world. The DAISY Award was established, again, to celebrate the extraordinary compassion nurses provide their patients and families every day, and just as Zach, you provided to Mark and his family. So now I would like to give Marcia, where'd she go, a chance to say some personal comments about Zach and their experiences together.
Mr. Matthews started working on 6th Floor at UIHC in January 2015, exactly 22 months ago. Just told me that yesterday. I knew immediately that Zach would fit in on our unit, as his confidence, his humor, and his compassion were great attributes for a unit like 6th Floor. He would often come into my office and talk about his patients, expressing his concern for them, how he really wanted to help them and their families, physically, emotionally, and mentally. And help them he did, as you will hear from the DAISY nomination. Zach is the perfect employee when a new product or practice needs to be rolled out. He loves to learn how to learn new skills. So when we needed staff to learn how to access and de-access infusion ports, Zach was right there. And when we had the opportunity to have staff learn how to use the Preview to start IVs, and then train others on using it, Zach was there. Evidently, when Zach gets asked to come to 6th Floor to start an IV, he's right there as well. He requests to be a preceptor, both for students and for new staff. He takes educating these future nurses very seriously and with a high level of responsibility. He appreciates going to different conferences and comes back to the unit and shares information that he has learned in an excited manner that only Zach can display. You see, Zach understands that his role as a nurse is one that includes learning and one that includes teaching. Within the past year, he received his Certified Medical Surgical Nursing RN, which again demonstrates his desire to learn. Zach's peers enjoy working with him. He's fun to work with and always works as a team player. In fact, he looks for things to do to help his peers. And he does the same for his patients, looking for ways to help them and make them feel special, all at the same time as giving high-quality care to them. After the past 22 months on 6th Floor, Zach has decided it's time to move onward and continue learning in true Zach fashion. He recently transferred to Fort Carver Cardiology, where I'm sure he will continue to flourish within the nursing profession. Zach, I'm very proud of you and so happy you are receiving this recognition. Congratulations.
Now, if you'd read the nomination.
Well, I know when you handed me these tissues, I thought, now I know why. This was a nomination letter that Mark and I worked on and submitted for you. I would like to nominate Zachary Matthews from 6th, our CP, as a deserving recipient of the DAISY Award. This nurse's extraordinary compassion and clinical skill exemplify the kind of nurse that our patients, our families, and our staff recognize as outstanding model. We would like to nominate Zach Matthews, RN, who works on 6th Floor Rye Carver, for the DAISY Award. My fiance, Mark Ilmberger, was a patient in your hospital for almost 6 months, from December 2015 until June of 2016. He was being treated for necrotizing pancreatitis. During those 6 months, Mark was never left alone. Either I or his sister stayed night and day with him. We had the opportunity to meet and observe many, many nurses. Admittedly, Mark was a lot of work for those nurses who had him for 12 hours at a time. Many different IV antibiotics infused one after another. His IVs only lasted so long, had to be reinserted. PICC lines clogged and needed to be worked on. Mark had almost constant nausea, vomiting, and hiccups. He had several nausea meds that were rotated as due around the clock to provide small relief. Mark had 3 drains in his abdomen that needed emptying and dressing changes, an NJ tube for around-the-clock tube feedings, which created loose urgent stools. Mark had at least 4 rapid responses called while at the university. He was often unstable. My point is, the nurse who chose or received Mark for a patient was going to work very hard for 12 hours. Many nurses took care of Mark only once or twice, probably opted out when given the choice. Zach took Mark as part of his patient load almost every time he was in Zach's area on the 6th floor. Mark was in and out of ICU and sometimes ended up in another area after leaving ICU. Zach often found Mark and stopped in just to say hello and show his concern and offer encouragement. When Mark had Zach for a nurse, we could get rest knowing his needs would be met. Mark's dressings were always changed, sometimes twice in the same shift, if needed. Despite Mark's protest, he was always turned from side to side with skin protectant applied if Zach was the nurse. We didn't have to watch the clock and ask for the next nausea medication to be due. Zach knew when it was due and brought it in a timely manner, even though these meds were PRN, not scheduled. Zach would anticipate Mark's needs and offer the medications when available. When something was not working, he had suggestions and did not hesitate to call the doctor for new orders. He came to the room with all the supplies needed the first time. He observed infection precautions at all times. Zach was never far away, and before leaving the room would always ask, "What else can I do for you?" Zach treated Mark with the utmost respect and compassion at all times. Not only was the patient care prompt and professional, it was friendly and lighthearted. Zach Matthews made a profound difference in our experience at the University of Iowa Hospital and deserves to be recognized for it.